Perfect. Hi, everyone. Thank you for joining us today. I have the pleasure to introduce you to a veterinarian, CEO, and founder of the Youth Bags. She's speaking on our topic today about the compassionate euthanasias. She's been active in the small animal practices since 1999 and is interested in the psychological aspects of the veterinary practice with the purpose of optimizing relationships, both within the care team and with the clients. Through the years, she's developed a personal approach to euthanasias, one that's had a huge impact on both the clients and on the veterinarians. So one of the things that Dr. LaRue, I said that wrong.
Almost. Dr. Celine's fine.
Dr. Celine has been very committed to sharing her knowledge in the clinic and experience with the veterinary teams to improve the experience of euthanasia for everyone involved in this process. In the past 5 years, she's been on a mission to share the best of what she has learned on the end of life and communications in the clinic and developed a race-approved CE platform called the Practical Classes of Small Animal Euthanasias. Not only is she committed to bringing us such value here today, but she is also a mother of 3 and loves to ride her ponies when she gets to get out of the office. So welcome, Dr. Celine.
Thank you, Lori.
Thank you.
So thank you, dear colleagues. It's really an honor to be here today and sharing some of your precious minutes in California, where I've never been yet. So the idea quickly is just to share the best tips, as I had to learn the hard way how to manage euthanasia, and just want to try to make everybody feel better around these difficult times. Lately, I had to work with some new grads and realized that within 20 years I graduated, there's been no progress as far as education around euthanasia in Quebec anyways. So often people ask me, how did you get this idea of creating a body bag for pets? And I thought, well, just repetition, thousands of times, giving my best at helping families during these difficult times, and then having to end the story, sadly, with a garbage bag, feeling ashamed, feeling not giving the best to my clients. And I just looked for options on the market, couldn't find anything that made sense. So just like doing a surgery I'd never done before, I thought, I'll just create a product, read the book and launch it, no problem. That's how we do vet med. We just have to improvise sometimes. And here we are now. So let's get started on sharing these tips that hopefully will make sense for you. So no matter how we perceive the quality of care we provide, it looks like we can do better, as close to 50% of professional complaints in Canada anyways are related to euthanasia. So no matter how we see it, there is something that people do not understand or feel frustrated about. So it's, again, always a question of perception. We as vet talk our own language, and we need to make sure that it's understandable for families. We do perform euthanasias on a regular basis and know how it goes, right? But we have to remember that those people do not know what we used to not know as well. So it's just about preparing them, giving them the time, and also making sure that their pet's dignity is preserved and using something appropriate for the new standards in 2020. Also, one more stat on this is that 20% of clients will not come back to your practice. So we're working so hard to bring these clients to our practice, and 1 in 5 will just never come back after euthanasia, just because it's too painful. It was too hard for them. But if we go the extra mile, they'll just go like, oh my God, these people care so much. Even if it's hard, I'll go back to this practice. So that was the only negative part of this presentation. It's all going to be positive from now on. So now I'm not ashamed anymore, after 20 years in practice, saying that I actually enjoy doing euthanasia. Why is that? because now I really feel this is where I can make a difference in their life. As I realized with time that these moments, these images would stay in the family's mind forever. And now strengthening this bond with the clients is fulfilling my need of making a difference and filling up my tank, my empathy tank, my compassion tank, my energy tank. And must be honest, nowadays we don't receive that many cards, or chocolate or cookies. And euthanasias are the best for that. This is where you can mark some points and get some delicious chocolates. So what do the family need? Guidance. They just need to know what's going to happen. They need you to format what you're going to say, thinking that you don't know anything about euthanasia. They also need a bit of active listening. Not talking about listening to them for hours, but just taking the time to ask them, do you have any special request? Is there something that you're fearing today and you'd like me to address? Just some understanding, some permission. Remember, they just feel judged. They feel like they're betraying their pet, and they need you to show them that you're with them instead of looking at them and possibly judging them. And they need a bit of time. So I'm not talking about listening to them for hours after euthanasia. My average is about, let's say a good 5 minutes after euthanasia, just to share some memories together, look at pictures, remember these things that this pet made us share together. And my victory is when the clients leave the room and they're crying, but they're smiling at the same time. And we feel that we've shared a moment. This is really where I feel I've done my best. And that's when I feel what I call compassion satisfaction, because I gave it all. I gave my max, and we went through something positive together. So quality of life, as you've probably noticed, so many people focus on the last couple of days of life of their pet that they've had maybe 15 years. So it's important to bring them back to looking at the whole picture, focusing on the great life they had together, and bringing them back to reality, that the pet they used to know, what they used to have, might never come back. He's not himself anymore. And that the best is likely behind him. A question I've asked my friend that had such a hard time taking that decision, I asked her this question: who are we keeping your pet alive for? And that somehow brought her to a different perspective. And then I asked her, if it would be you in the hallway that somebody has to flip sides every 4 hours, would you feel good about this? Is this what you would like as a person? And that, I worked on her for several weeks and she just couldn't give up. But then she said, oh God, you're so right. And then she grabbed the phone and took that appointment and thanked me for that later. So again, everybody's different. You got to try to talk about different angles to finally make them see the light. Again, another trick is just to bring them back to what used to make this pet happy. Was it chasing the squirrel, chasing the male guy? What was their thing? And are they able to do that again? Because as you know, I used to think that quality of life was only about appetite, but it's much more than that. So also have them look at old pictures, just sometimes 6 months earlier or a year earlier, and then they realize, oh my God, he's changed so much. There's no more light in his eyes, things like that. So there are some tools out there that are really easy to use for you. They are quality of life scales. They're questionnaires that you can hand out to your clients. I find that for so many years, I would tell the clients, you should you should start thinking about it, because the moment will probably come and his quality of life is decreasing. And then they had nothing to think about and also to share when they would go back home and the husband would ask, so what did the doctor say? Well, she said we should think about it. That's not enough. So if you're able to provide them with a copy, a questionnaire, something they can touch and share and talk about back home, it's helping so much. So there is a questionnaire, there's a paper that they can fill, classic. There's something more modern too for some of those clients. There's an app. There's an app for everything now. There's even one for quality of life. So it's called Gray Muzzle. It's free. It was developed by Mary Gardner, Danny McVitie. App Store, Google Store, easy to find. There are also some quality of life assessment for the family. You know, this old lady that has trouble just walking and she has to carry her pet 12 stairs up and down 3 times a day. She's not sleeping at night. So at one point, we also have to consider that. So this is the questionnaire called How Do I Know If It's Time? It was developed by Ohio State University. Some question that people have to ask themselves, ask our family. And then there are some questions on quality of life that is much more than the appetite. And then, of course, there's no score, like over 30, euthanize, under, keep him. But it's just giving them an idea of the trend of the quality of life. So that's really easy to print and to hand out to your clients, easy to find on our website. Also, that wonderful tool, Beep Pain Scale. You know, you hear it every day. Oh, he's not in pain. He doesn't cry, doctor. Oh, can't hear that anymore. So this is helping them to understand the nonverbal language of their pet. It's available for cats and dogs. Very helpful. So different tools for different kind of people. There's also that lady that will want just a calendar and put a happy face or a not happy face on the calendar. But so there's tools for any type of clients. That's the Feline Grimace Scale, pretty new, developed by University of Montreal. Very easy for the vet team and for the families as well to understand the cat's body language. A poem. So I'm just like throwing ideas at you. Something will make sense for you, hopefully. If it should be the poem I discovered 20 years ago, and it just makes so much sense. No reference to any religion, just showing how much this is an act of love instead of betraying your friend, bringing him for euthanasia. This is just helping them taking the decision or comfort them once they've taken the decision. So for my clients, all the ones that are not sure when to take the decision or that have taken the decision is just helping everybody. Very good feedback on that. Super simple, available on Google, everywhere, and on our website. So you hear that often, I would do anything for him. Well, there is a way to show that, and it's taking the decision that will make his suffering end and make your suffering start. That's just one way to word it, you know. So again, families are looking for permission. They need your support in that decision. Try to stay natural. So I've seen so many people in the euthanasia room that become so tense because they have a person crying in front of them. Just remember, it's not your fault if they're crying. It's actually a privileged moment. This person is crying in front of you. She hardly knows you, so she's trusting you. So just try not to take that on you, because we feel that naturally as a vet team, like, you know, so we need to help everybody and fix everything. So this is just something, try to be happy to be sharing a unique moment with them. And you can word it saying, you know, Mrs. Green, I know this is not easy today, but this is going to be a peaceful moment. He will be feeling much better than he's felt in a while. So just little words like that. Don't be afraid to talk. Don't be afraid to have silence as well. But just some sentences like that can help relieve some stress. Something also like, hey, handsome, how are you today? You know, they've been hearing for months or years, oh my God, your dog looks terrible. You should put him down. Oh, he's stinky. Oh, look at him. Just, you know, negative. Try to find something nice about this pet. There is something nice, his eyes or his coat, I don't know, but just underline that. Very quickly on nonverbal language, we're used to have the doctor here, the table, and the family on the other side. What about if we just go around the table and get closer to the person and get to his eye level? It changes everything. If you're able to just have some kind of physical contact, it can be just a finger on the shoulder, just something. There's something that goes through and helps the people feel better. a checklist, because now vet teams are getting bigger and bigger, and we have to make sure that every pet owner knows what's going to happen. All the little details on what sedation looks like, the onset of action. Remember, you're giving that Telazol to that cat, and 2 minutes later, he's on his side staring at the ceiling. That can be quite shocking for somebody that's never seen this. So we just need to tell them, remember, they don't know what you know. So with that memory aid, then you can also relieve your head, because you're making sure that you talked about everything. Otherwise, you're just like, oh, did I tell them that their eyes will stay open? This is so important that let them know that. So just by having a list, you're making sure everybody's talking about everything and that you're ready to go. You've talked about everything. We also have a checklist on the material. It's something ridiculous like that. Like a couple of times I was into the euthanasia room and then I go, oh, I forgot my stethoscope. It happened to me maybe 3-4 times in 20 years. I felt so stupid. I'm like, excuse me, I'll just come back in a minute. So if you have a checklist, make sure you got that form that is signed, stethoscope, turn on your phone, extra dose of euthanasia solution, and so on. Just try to free up your mind to be completely present. As vets, we have our own vocabulary. Just remember that. We have our own language. So what about, instead of saying, we'll put an IV catheter in, we'll put a device in his vein. Because even if they don't understand, remember that they won't tell you. They'll just go like, if you say, we'll give him a sedative. Oh yeah, no, it's a calming agent. He will feel very, very quiet, no pain. Then we'll inject a euthanasia solution, euthanasia, anesthesia, they're all mixed up. We'll give him a large dose of anesthetic, just like we use for surgery, but we'll keep on giving it to him. So he will pass peacefully in his sleep. That sounds better, I think. He will not suffer. I said that for 15 years. Don't worry, he will not suffer. What about he's going to be comfortable? Or you made the right decision. You made it. Good for you. No, now I say this is the right decision for your companion. We're doing the right thing for him together. You're the owner. I'm the professional. Together, this is what we think is the best. It will make them feel better. Oh, 16 years. It's a good age, for a golden. No. What about, I know it's never long enough, which is true. They'll never live long enough. When the moment will come. They'll never know. What about we call us when you want to talk about that decision, because it's difficult to decide. You can't do anything for him anymore. That's so sad. What about you say, you did an extraordinary job. You are an amazing pet parent. We did everything. I don't want to make the decision. Together, we'll make the best decision for your companion. Or, I wish you would fall asleep and not wake up. Well, this is what euthanasia does. What about that? I would like him to have a natural death. I hear this one all the time. Well, natural is neither fast or painless. His current state is not natural. We're keeping him alive, maybe artificially. So they just don't know what it can look like to have their pet in agony in the middle of the night. So we can prevent that. We can make sure it's going to be very stress-free. So the perspective, of course, the family, it's one time in their life and 20 years of fun they've had with this guy. For us, it could be several times a day, hundreds of times in the year. So just remember that when you walk into the room, take 1 sec to say, look, this is their moment with their pet. What they want is absence of stress, absence of pain. For us, we were trained to do it rapidly and without pain. But rapid for us and rapid for them is not the same thing. So just keep in mind that even if you don't find that vein, or you have to go, it's taking you more time. It's taking more time for the sedation to take effect. Don't worry, they're not in a rush. What they want is absence of stress, absence of pain. So for that matter, I really recommend to sedate. It's a must in 2021. AHA, AVMA, human-animal bond. Everybody agrees, vet schools. But in Canada, there's still 25% of vets that just animal comes into the room and they go directly with the euthanasia solution. Imagine how hard of a transition that is for families. So I really encourage you to take a look at that, and also potentially change your sedation to really a deep sedation to remove your stress and the families as well, and help a better transition into the experience. Before they come for the appointment, try to have them look at the crematorium website. Then they can take a decision, not being in tears at the front desk with people behind, buying dog food. Just try to give them time to make up their mind. Also think about referring them to mobile services. They cannot guess that this exists now, and it might be the best solution for them. And they might be very grateful for you to offer that. I'm sure you're busy enough. The crematorium, it took me 15 years to visit a crematorium. So I was sending these pets to crematorium without knowing what was really happening. So it made me feel much better when I was able to say, look, I know Denise, she's running that crematorium. She's only dedicated to animal cremation, because they don't know what's happening. There's been so many stories in the last decades that they just fear a bit what's going to happen in the crematorium. And then you're able to talk about this like you would be talking about a treatment, that you've read about it, what it's about. So it's something important just to invest half a day in visiting the crematorium you're partnering with. And actually, the AVMA came up with a policy on aftercare. And here's the good news. Now we're accountable for one more thing, which is the aftercare provider we recommend. So this is really new, and it's something important to know. So it even stresses more the fact that you have to go and visit that crematorium and not only pick the service on the price or how nice the guy that comes to pick up the body is. It's very important to know what you're selling. Also, they underline the fact that we should provide adequate containment of the remains. That's important to know. If we don't know if a plastic bag is adequate, but here they underline that it should be in a condition suitable for return. So then now we're sure that a garbage bag is not quite suitable for return. Important to know what the crematorium looks like, what it feels like. When you have, Lori, can you tell me how many minutes left I have? Or Kelly?
Yeah, right on 4 minutes.
4 minutes. Okay. Just make sure that the room feels like they were waited for, and not just like pull up the alcohol and the needles as you talk about the sedation like I used to do. Just try to have everything ready when they come in. Try not to weigh the animal that day. It's really perceived in a negative way from the owners, as they don't want to be separate from their pet, not even 1 second that day. All those minutes are very precious. You can guess the weight, I'm sure. Also, instead of saying, oh, just fill up that form, what about you would say, you just have to sign here to allow us to perform euthanasia today. Some vets will just have a eutha bag in the room and put the name on the bag. It makes people see that we have something appropriate. It makes them see that their animal is going to be protected. And you can even allow families to decorate or sign the bag, or just feel involved, And also, naturally, families will want to close the bag. Of course, you ask them first, would you like to be present when we'll put your animal in a body bag? It's so important for some people that they put it on Instagram. Zeus left in dignity. For them, he had to share this with his community. So just remember, everybody's different and might be important for your clients. So this is Eutha bag. It's got integrated handles, so it's made to be practical, adapted to our very special needs in vet med. So you don't need to go get the stretcher every time. It's thick. It's ecological, made with post-consumer recycled material. It's, of course, leak-proof, and you can identify it just to make sure you don't lose track of Fluffy because the sticker went undone in the freezer. and it's meant for cremation or take home. It's just for whatever the next destination is. It's available in 5 sizes, and the average price is $7.75. So it ranges from $4.84 for a guinea pig to $16 for a Great Dane. So just quickly, a study done by Kathy Cooney, who is the KOL on end of life in the States, on 2,000 pet owners in the States last year. For them, only 15% of pet owners think that the plastic bag is an acceptable solution for their pet aftercare. So might just think about it, that are we basing our choices on 50% or on 60% that do not think it's acceptable? It's easy. You can just add $10 to your euthanasia fees and use Euthabag for all of your patients, make your veterinary team feel better, and respect most of your clients' preference. So our free race approved CE on euthanasia and well-being is available anytime. It's free, and we have so many tips to share with you. 7 credits of CE, and on pre-euthanasia sedation protocols for common reactive, something unique on oral and injectable options with some dosing charts. So milliliters per kg, you don't need to calculate, and different protocols depending on what you have on hand. And more in details what we just talked about quickly today. Also handling euthanasia as a new grad. If some new grad are joining your team, it's a nice hour and a half invested in preventing them to do those painful mistakes I had to go through. And also a module on compassion fatigue, really positive, nothing depressing. Compassion fatigue is natural, it's normal because we are compassionate and provide compassionate care, but it's all good. And we're here to help. We have some resources on the website, all the handouts we talked about. We also have some coloring pages for children, a handout on children in grief for parents as well, books on pet loss, the memory aids we talked about, and some sympathy card wording. I think this is just wanted to say that Euthabag supports Canine Companion for Independence and Susan J. Komen Foundation. And just want to say thank you. You are the best. I find we are providing extraordinary care for pets and their family.
Thank you so much, Celine. So my gosh, like my favorite part, just what you're saying, is giving them the feeling like they, like, instead of saying you can't do something or like you can't do anything for them, giving them the power, like you made the best decision. I think that was the part that hit home for me in your talk today. Just giving them the feeling that we made the decision together. A lot of just empowering them and like, you are making a good decision, like we're doing this together. I thought that was wonderful. Also, for those who are in the room today with us, I put the CE credit opportunities in the chat box. So feel free to check out the website here for Celine, and that's where you get access to your 6.5 CE credits, which are free. So that's just a huge thank you to Celine and what she offers to everyone. And thank you all for joining us. I don't want to hold you guys up. It's more than, we're a little over time by 2 minutes. And so if you have extra questions, any questions, please feel free to come off mute. If you have to take off, I understand it's over time now. So if you have any questions on there, please feel free to stay on. And also, so Celine, I had one question for you, for those who can stay on. In your talk, you mentioned if you can touch a client, just any kind of contact. Right now during COVID times, there were some questions when people were registering. They were saying, especially right now, how can you show contact or connection without really touching them during this unusual time?
Yeah, you're right. And we do have actually one presentation on the platform on euthanasia during COVID. Of course, I think now it's going through eye contact mostly and just recognizing that you kind of understand, you're with them, you've been through that. I think that does it. But yeah, of course, I guess I'm too optimistic on when this is going to end, and I treated it like it was back to normal. But yes, you're right.
Yeah, and I remember last
I
year.
still think we can touch somebody, if we wash our hands, and we'll wash our hands after anyways. I think you could still put a hand on the shoulder without much risk. And sorry, what were you going to say, Kelly?
Oh no, just from last year, I remember the Jocelyn did that webinar on during this time, not touching but still being connection. So that was nice too. Yeah, so thank you so much. If anyone has any questions, please feel free to hop off mute. We'd love to hear them. And we have 2 more days of our topic where it's holistic animal care, and we're talking about open wounds and euthanasia compassionate care for them. So we have 2 more days of learning from us. And yeah, if anyone have any questions, feel free to hop off mute. Otherwise, I'll see you all tomorrow.
Thank you, everybody, for joining.
Thank you. Have a great day in California.
Oh, thank you. Bye-bye.
Bye.